there is still hope. Unless the photo shows a white pupil. After the examination, the results are clear. It is cancer in both eyes.
For a 4-month-old child to have such big tumor in both the eyes, it's a sign of a very aggressive tumor.
Nepal, Kathmandu, the Tilganga hospital. Every day, 1,200 patients come here. Some need the help of a specialist.
As a doctor who is treating for retinoblastoma, I don't want to see such a devastating pictures who are going to die next day or next week. So we want to make their life also livable with good vision, with good future, good perspective.
The diagnosis? Bilateral retinoblastoma. Little Rai is suffering. Chemotherapy is getting the best of him. Once he is under general anesthetic, Dr. Rohit will examine and treat him.
So the purpose of this examination under anesthesia is to see the lesion, to see the tumor mass, how it behaves. It is progressing, getting bigger and bigger, or it is regressing, getting smaller and smaller. So it is getting smaller and smaller, we are happy. We will put more laser, we'll continue the chemotherapy, it will go up. Okay. If it is not responding to our therapy, then we have to modify our treatment.
What do you mean with modify?
If the tumor enlarges, then we may need, probably we might not, but if it enlarges unresponsive to the chemotherapy and laser therapy, we have to take out the eye.
Dr. Purnima explains to Anusha's parents that their daughter is in critical condition and that she has an aggressive cancer in her eye that should have been treated long ago.
They never heard. They never knew about the disease. They never heard about it. And even when I was trying to explain about the disease to the patient, the father was like not understanding much. I showed them the information book sheet we give to the patient to read. They said that they cannot read. They are both illiterate. So when they don't understand, they will think, let's go home and get some other forms of treatment, maybe some, faith healers treatment or something. We'll try that. We'll ask other people in the villages. Then we'll think about it. Those kind of things can happen.
The people of Nepal are religious. They believe in the power of their gods. They believe in the force of prayer. Medical and health education is hard to instill in view of those higher powers, especially in rural areas, in the region bordering India or on the foothills of the Himalaya Massif.
In the different remote part of the country, people are not educated about the retinoblastoma. So to save and to pick up the disease earlier stages, for that we need the awareness.
So we can, call all those people there who work there as a health professionals and then give them awareness.
Awareness to the public, awareness to the paramedics, primary health take carer, awareness to the pediatricians.
Yes, awareness can be this cute. Monica König and the employees of the Children's Eye Cancer Foundation want to contribute to making the early detection of this disease a reality in Nepal. There is a lot to do. For Dr. Purnima, the work at the Tilganga Hospital is an affair of the heart. Last year, the Children's Eye Cancer Foundation offered her a fellowship. To further her studies in the field of retinoblastoma, she was a visiting physician at the renowned eye clinic in Philadelphia for 6 months. The working conditions were first-rate. No comparison to the daily medical routine in Nepal. Nevertheless, Purnima's place is here.
Here, if I can do something, some changes here, then it will be a big impact for the people out here. There, if I do, then it won't make any difference. I'll be no one there. Here, I know that if I can follow some of their steps, I can make a big impact, even with the small step also.
The Children's Eye Cancer Foundation is helping to build a new ward for retinoblastoma patients. Dr. Purnima will be the director.
We want to streamline it to one single department so we can see both examination part, treatment part, sending for CT scan part, all in one single department, so we don't lose the patient.
For example, like we don't have chemotherapy service here. For the chemotherapy, we send our patient to the children's hospital, government children's hospital.
There is no other way. The parents of Anusha receive a referral to a different hospital, where their daughter is scheduled to start with chemotherapy as soon as possible. But will they actually show up there or go back to their village? If they also just go back to hoping and praying, the situation would become life-threatening.
If he goes home without treatment, then he could develop another tumor in the brain, or it could spread to other parts of the body and the child could die.
There is still a lot of chaos. Old and young, follow-ups for young cancer patients, routine checkups, everything happens at once. Purnima treats a retinoblastoma patient. Next to them, a cataract is being operated on. Whether it is a conjunctivitis or metastases in the optic nerve, with this much demand, it doesn't make a difference. And this has to change soon too.
We are making a special center dealing for the retinoblastoma cases for the nation or beyond the nation, and we have thought that we put the name as a KAKS, Tilganga Retinoblastoma National Center. Okay, it's time.
Rai's checkups are due, whether he wants it or not. He obviously doesn't, but this is about his life. What's striking when looking at the operating room is there isn't much equipment.
I don't see red cam.
We don't have. We need that one.
We need that.
It is good for the diagnosis also. It is good for the therapy also.
Rai is under sedation. Dr. Rohit will now examine whether chemotherapy has diminished the cancer in Rai's eyes. Meanwhile, Dr. Purnima has found a friend. Her name is Yanisha. 2 years ago, the doctors had to remove her right eye. The follow-up today showed negative results. She can go back home. Today, Yanisha has guests. Her mother has invited Dr. Purnima and the German woman for tea. Her name is Priya, and she tells us her story.
At that time, we were told that our child has a tumor in her eye. We had never heard of the disease before. Because Yanisha was so small, we were afraid of the surgery. We went back home. After a few months, the eye kept getting bigger and started to bulge out of the eye socket. The healer told us it might be due to a dust particle in her eye and would disappear someday. But then we became scared and went back to the hospital to visit Dr. Purnima. She was operated immediately.
Rai's treatment takes longer than expected. Dr. Rohit tries to destroy the tumorous cells in the eye by using laser beams. He seems tense.
His left eye is not doing good, so the tumor size is getting increased. Another is the macula, the most sensitive part of the retina is involved, and the visual nerve, what we call the optic disc. the vision nerve also involved. That's why we might need to take out eyeball. Yeah.
So that's bad news.
That is not good news, yeah.
It will be a hard time for the parents. They come from far away. The treatment will go on for months. Where are they supposed to live? How can they supply the money for further treatments? It is these questions that trouble Monika König as well.
I couldn't believe that parents need to find an accommodation by themselves while the child is in the hospital. In Germany, there's housing for parents where they can talk to other parents and patients. In Kathmandu, they have to stay for months until the end of the chemotherapy. So finding a place to live is completely up to the families, which is something most of them cannot afford. This is why many go back to their villages and come back later when the disease has progressed too far to save the child's life. It is obvious that this is where we have to start our work, with a special focus on supporting the parents.
So it isn't just about the children of the Tilganga. Yet it is still first and foremost because of this. Unretouched, these pictures are unbearable. Cancerous growth, as big as a tennis ball, festering out of the eye socket. Retinoblastoma in its terminal stage. A death sentence. Therefore, the creation of a national treatment center for retinoblastoma patients is an important step. But more needs to happen. More education for even more doctors. Better medical equipment. A retinoblastoma awareness program. A parent's house, and so much more. This cancer is cruel, no matter where in the world. But in a country like Nepal, it is often deadly.
This is absolutely the right place for our work.